Hello everyone, I'm Elif from the height reduction team. Today we will be discussing the most frequently asked questions and also some negative comments that we encounter in our social media platforms. We've seen a lot of attention from various news outlets and we thank you so much for the attention you had so far. However, we can understand that people might have misinformation about the procedure and they might have questions in their head that they want answers to. So I've collected some of the questions and some of the comments that people sent to us from TikTok, Reddit, and various other social media platforms, and I will be diving into them. The first question is from Reddit, and they're asking, is there such a thing as height reduction surgery? Yes, there is, and we have performed 10 cosmetical height reduction surgeries. Height reduction surgery has been long done for people who had leg discrepancies, who have skeletal problems, or overall proportion issues. So it was done on only one singular leg, on one singular limb, because it can be done on arm as well. But people can also pursue such operation in order to feel psychologically better. They might be wanting to get the surgery done because of a gender affirming journey. There is no one answer or one reasoning for why people want to proceed with such surgery. Height might cause discomfort to a person, or they might feel imbalanced. Therefore, it is a surgery that has been long done, but we are only making it cosmetically because not everyone feels comfortable being tall. Second question is going to be why? Why people want to get this surgery? Why would people want to get shorter? And this is such a frequently asked question, and I can understand because normally being taller is desired more. People feel like when they're taller, they might accomplish something, and some people might not understand why people would want to get shorter. Basically, the main reason is not everyone is going to be enjoying being taller. This is not something that everyone desires. A person might even struggle from heart issues, heart problems, or skeletal problems because they're too tall. They might feel like they're not fitting in because in the country that they're from, they might be taller than everyone else. There might be also, like I said, going through a gender affirmation care, and this might be one of the reasons why they want to shorten. So it's not about wanting to be shorter, it's more about people feeling comfortable in their body, and we are not the people to judge, or we're not here to make assumptions about other people. Of course, when a patient comes and they want to get the surgery, our doctor talks with them and they try to make sure why they want to pursue the surgery. Are they going to regret getting the surgery? Our doctor doesn't just straight away does the surgery with patients. And if we feel like this patient is not going to be benefiting from the surgery, we might reject them. We might want them to go talk with a mental health professional first so that they can understand why they are wanting such a surgery. So there isn't a one singular answer to why, because everyone's desires and needs might be different. The third question is going to be, is that safe? So people usually ask about the complications and the risks of the surgery, and it is a really valid question because you're going to be getting a surgical procedure, and of course there are always risks involved with surgical procedures. We can never tell our patients that there will be zero risks involved, and if anyone is suggesting that there will be zero risks involved with any type of surgery, please don't trust them, please don't listen to them, because that is simply not realistic. So there are always going to be risks involved with surgeries, and this surgery also have some risks that they might occur. Infections, muscle stiffness, nerve pain. There can also be delayed bone healing as well. So there are a couple of risks that are involved. But when this surgery is performed by an experienced team and an experienced doctor, the risks are really decreased because we can early detect if there's any risks like developing. We can early detect if there's a problem with your nerve or there's an infection, and the surgery is not actually eligible for infection because you don't have any big open wounds or you don't have a big scarring, also like an external fixator on your leg. So you'll only be having intramedullary rod inside of your bone. Therefore, there are really rarely cases of infection, and we have never encountered any type of side effect that I've mentioned. So while there is always a risk, we have never encountered them because we have a really experienced team who knows what they're doing. And when you're working with a team who have dealt with orthopedic lengthening or shortening surgeries various times before, they will be knowing what to expect. So like I said, there are always risks involved, but it is relatively a lot easier and a lot safer surgery than what people think it is. The fourth question, it's not really a question, it's more of like a comment, is going to be crazy. She was born lucky, and because of envious people, she moved the luckiest thing she had. Sometimes it might look like luck to someone. So sometimes it might look like it is luck, what other people has, but it might feel like a burden to the other person. We can never know what they're going through. We can never know what their height is causing them in their social life, in their private life. And we can never know why people want to go through with the surgery. As I explained, it is never it is never on to us to assume people's needs and wants. While we don't straightly dive into the surgery and just perform everyone that wants to get the surgery done, people might have really valid and really special needs and reasonings on why they want to do the surgery. It's not about envy, and it's not about what other people want or need. Basically, it's about patient making peace with their body and feeling comfortable in themselves. Another really good question and really highly asked question is going to be, I want that, but my arms will look too long compared to my legs. That's actually a very common concern, like I said, and it's a really valid question. Before we start surgery, our doctor is going to be doing a couple of tests to determine if you're eligible for the surgery. You should not have any chronic illness that will be causing a delay in the healing of your bones. Also, you need to be above 18 normally, because in order to perform the surgery, we need your growth plates to be closed. So during the planning, doctor will be taking a look at your proportions. He will be taking a look at your wingspan to see how much is going to be the safest, smoothest, and the healthiest to take from your legs, from your bones. And with that, he will be determining the bone segments, centimeters. The recovery actually takes months, not years, and you will be able to walk straight away after the surgery. You will get up, you will walk with support, and after the 6-week mark, you will be able to walk without support and gradually return back to your daily activities. So it's not like what people expect, or it's not as dangerous as people make it seem. That's why we want to raise awareness, and we want people to understand that this is not an invasive surgery. This is not a surgery that will be causing you permanent damage, or you will not be crippled after the surgery, basically. After the full bone healing and rehab, patients can walk again, they can run again, and they can do intensive workouts and supports. So it's all about patience and being guided properly. So that will be all for today's questions. If you guys have any other questions or any other comments, you may leave a comment down below and we can further discuss in the comments. Thank you so much for all the love and support and the curiosity that you have overall around this procedure. We're gonna see you in the next video. Thank you.